So now, in your experience, how have your patients kind of been handling this news that these surgeries are being delayed?
For the most part, people have been very understanding. Nobody is really blind to what's going on right now. Um, it's been very stressful and saddening giving news to patients that they couldn't have surgery at this point. That's probably been the most, or one of the most difficult components of this for us. Um, but they're all understanding. They know that in the balance of risks and benefits, the risks of having surgery at this point are too great. And another thing, beyond surgery, which 99 or 95% of the time goes smoothly, there can always be little bends in the road and things you need to deal with. So, that's one reason that you don't want to challenge the system or put yourself in a situation where you have to have additional treatments just because of the current situation. So most people are very understanding, but it's a difficult conversation.
So with that being said, the conversation aspect of it, what are some things that you've been doing to advise your patients to kind of maybe ease any concerns that they have about, oh, my surgery is now being delayed, or is it kind of they seem, like you said, they seem to be getting it?
There's getting it, and then there's coming to terms with it, and then there's coping emotionally with that. So, in our practice, we like to be as available as we can for our patients. We have what we call a patient empowerment program run by one of the women in our practice that essentially lends a shoulder and an open ear for women and their families that are going through this. So it's essentially a support group in a telemedicine fashion, and we either communicate with our patients directly. I've called patients, text patients, just to say, just to check in how they're doing. Obviously, I can't always provide a solution at this point, but just know that we're still thinking about them, and we're still here for them, and have them on our minds and on our lists to book them as soon as we can. So I think those two components are helping all of us get through this. It also helps me. So, I've been in medicine for 25 years, I guess, through training and so on. And it's a huge part of my life. And not being able to do what I do is a little bit disorienting. So for me, it's been very nice to be able to provide remote consultations, even though some things may be very theoretical at this point because I can't act on my recommendations or suggestions. But I think just giving people some hope that there is a light at the end of yet another tunnel, and we're there at the other end, hopefully.